Good morning, student. So, our today's topic is the homeopathic therapeutic for the diseases of the eyelid. Before studied this topic, we was learned in previous lectures that what are the diseases of the eyelids. So, in that we was learn about the many diseases of the eyelid, that is firstly the congenital anomalies of the eyelid, that is the congenital coloboma, ptosis, epicanthus, distisis, cryptophthalmos. Then next is the inflammatory diseases of the eyelid, in which we was studied about the blepharitis and its types in detail. Sties, chalazion, internal hordeolum, molluscum contagiosum, anomalies in the position of the lashes and the lid margin, that is trichisis, entropion, ectropion, cymbelophoron, ankylophoron, blepharophimosis, leg of thermos, blepharospasm, and last one is the tumor of the eyelid. So after the tumors of the eyelid, for today, we will learn about the homeopathic therapeutics of the diseases of the eyelid. So, there are many remedies in the homeopathy for the many diseases of the eyelid. That is, in the ectropion, we can use the nitric acid. For the entropion, we can use argentum nitricum, borax, mercur. For the ptosis, in a patient, we can use aconite, alumina, causticum, conium, gelsemium, kali mur, rustox, euphrasia, ledum pal, radium, spigelia, and stamina. Then, for the styes, that is the hordeolum, we can use agaricus, epis, aurum mate, calcarea, pick, then conium, graphitis, hipparcel, lycopodium, mercor, pulsatilla, sepia, cilicia, thuja, and urine. So, for the styes followed by the hard nodocytes. That is, after the styes, there is a formation of the hard nodocytes indicated the conium, staphysagria, and thuja. So, we can think about these remedies when there is a hard nodocytes formation after the style. For the chalazion, in homeopathy, there are many remedies like antimtat, calcarea car, causticum, conium, kali iode, plantus, cilicia, staphysagria, thuja, and zincum. And for the leg ophthalmos, the physostigma is one of the important remedy useful in a homeopathy. So, they the signs and the symptoms. So, according to the signs and symptoms, the treatment of homeopathy is very useful when there is a patient told that when there is a leads are agglutinated, though in that case we can use the antimcrude or mate, phytolacca, sepia, and sickle cord. And when there is a blinking of the lid, then we can use agaricus and salt. When there is a bluish appearance of the lid, then there is a paragia and phytolacca is useful. And when there are objective symptoms, like the objective symptoms are that we see on the patient. So when patient come in our clinic, what the signs we are seen in a patient, these are the objective symptoms. And subjective symptoms are that the patient feel internally, that these are the subjective symptoms. So now we study about the objective symptoms. In that case, when there is a close involuntarily, lids are closed involuntarily, then nitrum carb and sepia is useful. And when lid close forcefully and spasmodically, then hypersal mercurius nitrum mood is indicated. And where is the drooping of the eyelid, then alumina, apis, belladonna, causticum, conium, gelsemium, nitrum car, nitric acid, nux moschata, opium, phosphorus, picric acid, rust tox, sepia, spigelia, sulfur is indicated. And when leads are dry inner surface, then sulfur is one of the most useful remedy in dryness of the lid to the inner surface. When the leaves are edematous, then acetic acid, apis, arsenic, kalica, kali iode, phosphorus, phytolacca, rustock are used. And when edges of the lid are inflamed, then aconite, graphitis, nux vomica, and staphysagrina is useful. When lids are red, then antimcrude, belladonna, chelidonium, euphrasia, graphitis, kali, bichromum, lilium teak, nitrum us, nitrum mur, and petroleum. These are the useful remedies in the redness of the lid. So, there is a homeopathic therapeutics for the acute blepharitis. In that case, aconite, apis mellifica, argentum nitricum, arsenic album, chamomilla, digitalis, delcamara, euphrasia, hyparsal, creosotum, merc iodum flavum, merc flu rub, merc son, nitrum earth, petroleum, pulsatilla, rustox, sulfur, upas, urate are the useful remedies in acute blepharitis. Then the homeopathic therapy is for the chronic blepharitis. In that cases, alumina, antimcrude, argentum nitricum, aurum, baritacar, borax, calcareaca, clematis, euphrasia, graphitis, hipparcel, jiggle, mercor, mercurubum, petroleum, sorinum, sepia, silicia, staphysagrina, sulfur, and tellurium. These are the most useful remedies in cases of the chronic blepharitis. So, these are in short that what are the remedies indicated in the cases of the diseases of the eyelid. So now we can study about the short or in detail that what are the how these remedies are useful in the cases of the treatment of the eyelid. So first one is aconite nepellus. Aconite nepellus shows the objective symptom that leads are red, swollen hard, especially the upper. In the morning, edges are sore, inflamed. There is a chemosis, conjunctiva intensely hyperemic, edematous, and mostly toward the inner canthus, and lacrimation slight, if any. These are symptoms which are seen in a patient when come in a clinic. And subjectively, the patient feel that there is a burning in eyes with dryness, sensitive to air, there is much aching and heat, intense burning, shooting pain, and pressure upon the lid, as if ball were pushed into the orbit and causing a bluish pain in the eye. There is a itching, smarting in the evening, the eyeball, especially the upper half sensitive if moved, and looking down on turning the eyes, the eyeball feel enlarged as if protruding and making the lid tense. So feel as if it would be forced out of the orbit, stooping, eyes feel swollen, eyes feels as if sand were them and there is a photophobia. So, by the vision, as to have it difficult to distinguish the faces, spark before the eyes, there is a flickering. Characteristics are the aconite patient is characterized by a great anxiety, fear, and restlessness, and thirst. There is a first stage of inflammation or trauma of the cornea, conjunctiva, and sclera. The routine remedy with the foreign bodies are wounds operation and for the neuralgia from exposure to the cold and dry wind. Next one is a antimonium. So antimonium crudum is also useful remedy when objectively the patient shows that leads are red, inflamed, excoriated, agglutinated, and outer canthi are sore. And subjectively there is a itching, soreness, and photophobia. With the characteristics are that it acts on the mucous membrane. The weak there is a depression and excessive secretion. Cross devilish children in an older person with the white coated tongue is an important characteristic of antincrude as we learn in the homeopathic mathematics with the alternate constipation and diarrhea. Clinically, it is a useful remedy for the blepharitis and scrofulous ophthalmic complaint with the pustules on the face, cornea, or conjunctivitis. So the next one is the Apis mellifica. It is made from the honeybee and the tincture is made from the honeybee and is but little stronger than the 3x trituration of the APM virus, which is made by extracting and triturating the poison cell. Objectively, the patient shows that leads are much swollen, pale, red, there is edema, then upper one hang like a cell, and conjunctivitis are inflamed, edematous with the dark red vein, and lacrimation is a found. There is a agglutination. So subjectively, patient feels that there is itching, stinging, sharp piercing pain in and about the eyes with the burning, stinging, which causes the lacrimation, soreness, and smarting in the eyes. So, leads, edges, and canthine. There is a fullness, photophobia, eyes pain are easily fatigued. There is a sensation of a foreign body, then vision obscured, difficult with the whirling and pain on using the eyes. And characteristics are that there is a thirstlessness, even with the fever and drowsiness, edema, dropsy, skin is waxy and white. Clinically, there is a blepharitis, corneal ulcer, erysipelas, staphyloma. Then, after a suppurative inflammation, albuminuria, retinitis, and useful in the various form of the keratitis. In the purulent edema and iron, there is a temporary from applying the cold water, an extremely valuable remedy in the inflammatory affection of the eyes, always characterized by serous exudation, edema, and sudden piercing pain. So, next one is the urgentum metricum. Objectively, the patient of the urgentum shows that there is a eyes are closed by swollen and inflamed lid. There is ocular and palpebral conjunctiva and caruncle intensity are swollen, red and inflamed with the clusters of intensely red blood vessel from the inner canthus to cornea. The discharges of argentum are profuse, bland, mucopurulent, or of thick yellow pus with the cornea is opaque and may be covered with the conjunctival fluid that is lacrimal. Subjectively, the patient feels that there is a photophobia. Pains are intense. There is a heaviness over the eyes which open with difficulty and there is a boring above the left eye with the infraorbital neuralgia. Burning, biting, itching in the eyes, particularly in the canthi, and heat and pain in the eyeball upon the motion and touch. So there is a aching pain deep in the eye early in the morning and all symptoms are aggravated by the heat. So vision is there is a gray spot and serpent like bodies move before the eye and sudden vanishing of sight from inability to maintain the focus. So, after the urgent nitric comes, the one of the most important deep acting remedy is arsenic alum. Objectively, the patient shows that the leads are edematous, swollen, usually non-inflammatory and painless. The edematous lid firmly closed as look as if distended with the air, conjunctiva palpable or ocular inflamed. There is a burning acrid lacrimation, making the lid and cheek red and sore. Subjectively, the patient feels that there is a severe burning and or the burning pain in the eyes, in the lid edges, and eyes feel dry as if rubbed by the lid. Peeling off the sand and obliging him to rub the eyes in the evening with the eyes are hot, with the burning sore pain in the ball, and the feeling as though they had no room in the orbit. So there is a pulsating, throbbing pain in the eyes, and with the every pulsation a stitch. After a midnight, and supraorbital pain are left with the pricking as with the needles. There is a ciliary neuralgia and fine burning pain with the photophobia. Characteristics are defined in that case is that there is a great restlessness and anxiety with the weakness, prostration and the thirst for the very frequent small play. After a midnight, there is a burning pain, emaciation generally by the warm application, anguish, despair, and dread of the day. Clinically, there is a puffiness below the eye, corneal ulcer, scrofulous ophthalmia, chronic trachoma, keratitis, iritis, disseminated choroiditis, and blepharitis with the hyperthyroidism. Next one is the Baraita carbonica. So, Baraita shows the red conjunctiva, swollen lid, and dryness of the eyes. And subjectively, the patient feels that there is a photophobia and itching in the eyes. With the visions are light dazzle and hurt the eyes with the fiery spot in the dark. Gauze before the eyes in the morning and after a meal. So there is a weakness of the sight. So he can't see. There is a light dazzle and hurt the eyes, and he see that gauze before the eyes. So there is a no clear vision in the parataka. With the characteristic is that these remedy affect the nutrition profoundly. So there is a much affection in the nutrition causes a symptom of malnutrition and consequent degenerative tissue changes, which irritates and depresses the cerebral and the ganglionic nervous system to a picture of mental and physical decay and is particularly useful for the glandular affection of the throat and neck. So this is all about the Barataka. Next is the borax. So borax is also useful in the eye complaint when there is a disease of the eyelid and patient shows that there is a lashes turn into an inflamed eyes, that is entropy. So borax is useful remedy for the entropy. Remember it. And especially at the outer canthus where the lid margin are very sore and lashes are irregular, there is a nocturnal agglutination and left in the canthus is also. So, in the region is bright waves and moving now from the right to the left and now from above downward. So, moving when writing. And characteristics is that there is a dread of downward motion. Is the most important key feature of borex. Clinically, it is useful in the marginal blepharitis, matrosis, entropion, and trichis. So, as we see, the lashes turn into this is a main symptom of the entropion. This is seen in the borax with the marginal blepharitis. The next is the chamomilla. Chamomilla shows when lids are swollen in the morning, there is agglutinated, purulent mucus, and conjunctiva is swollen and red with the lacrimation. There is a subjectively the patient feels that there is intense photophobia, heat, burning in the eyes with the stitches in the orbital region and soreness in the canthus. With the pressure in the orbital region and in the eye, with the sensation in the eyeball as it compresses on the side. Vision that momentarily obscured with the last mentioned symptom and characteristic that is excessive sensitiveness, the nervous seem bare on edges, with pain, sensation are unbearable, hence irritable, cross and peevish. So clinically has been used internally and locally for the conjunctivitis, profilus, ophthalmia and relieving the suffering and for the flare. So next one is the Calcarea calm. Calcarea calm is a deep-acting constitutional remedy is useful in the eye complaint when the disease of the eyelid shows there is a swelling and redness of the lid with the sensitive to light, blepharitis, lacrimation in open air and early in the morning with the spot and ulcers on the cornea, lacrimal duct closed from the exposure to the cold with the eyes are fatigue, far-sighted, itching of the lid, swollen, there is a chronic dilatation of the pupil with the cataract and dimness of the vision as if looking through a mist. Then there is a lacrimal fistula and worse by exertion that is mental, physical and better by the light. So these all about the calcarea calm and next is the causticum. So causticum objectively the patient when shows the pupils are dilated and visible twitches in the lid and left eyebrow with the eyes are inflamed, lids are red, there is a lacrimation in open air, then causticum is used. Subjectively, the causticum patient feels that there is a pressure as if sand were in the eyes, with the dryness, photophobia, burning and stinging with the inflammation, and there is a pressive pain in the eyes by the touch. So, inclination to close the eyes, they close involuntarily, and sensation of heaviness in the upper lid as if he could not raise it easily. So vision is indistinct and dim. So there is a dim vision and indistinct vision in a caustic. So clinically, causticum is useful when there is a peripheral paralysis of the muscle, that is levator palpebrae superioris, orbicularis oculi, external rectus and ciliary muscle. In that cases, causticum is the principal remedy for the ptosis and paretic aphonia. So, it is useful in the post-diphtheric cases when there is a paretic aphonia with the peripheral paralysis of the eye muscles. Then the Conia mac. So, Conia mac is a common name is a poison hemlock, and objectively the patient shows that there is a white of the eye yellow. So whiteness of the eye shows yellowness, pupil dilated, there is a sluggish pupil and lacrimation with the lids are drooping. So it is useful for the drooping of the eyelid, ptosis and paresis of ecdyph. So conine mac is useful when there is a paresis of the extrinsic muscles and subjectively the patient feels that there is an intense photophobia with little or no redness. Then there is a weakness and dazzling of the eyes with the giddiness and debility, especially of the arm. Next one is a digitalis purpura. So, objectively, when the patient shows that there is a mydriasis, the lid margins are red, swollen, and agglutinated in the morning, and subjectively, patient shows the photophobia. B. Vision are objects appear green or yellow. Patient shows that there is a green or yellow vision, and there is muscular monotonous while walking in the morning, in the upper part of the visual field seem covered by a dark cloud. So, upper part of the visual field shows the dark cloud, so he can see only the lower half. So, digitalis in that case, this is the important feature that patient can't see the upper half as he feels that it is covered by a dark cloud. Clinically has been used for the detachment of the retina and flesh. Next is the Dalkamara. Dalkamara is useful when there is every time he take a fold it settle in the eyes. So there is an aggravation from the fold. Thick and yellow discharge with the granular lid and blepharitis, hay fever, profuse and watery discharge which are worse in the open air and cold weather. So these are in short about the Delcamara in eye contact. So Euphrasia officinalis. We all know this is a very important remedy in the diseases of the eye. So conjunctiviva injection leads on their margins are swollen and red and profuse acrid lacrimation with the bland coryza. This is the characteristic feature of the Euphrasia officinalis as we learn in the homeopathic maternity. So subjectively the patient shows that there is a photophobia. The eyes are sensitive to the candlelight. Then there is a frequent inclination to the blink and feeling as if cornea were covered with a mud which obscure the vision and obliges him frequently to close and press the lid together. So tears are hot and biting, its lids are burned and itchy, the red margins feel dry, in eyes there is a burning, biting, itching, and obliges frequent winking. Sometimes it is a dim, as though a veil in the evening. There is a blur vision, and better by wiping the eyes or winking. Clinically, the corneal ulcer staphyloma after the suppurative inflammation, corneal pustule, keratitis, cataract, and blepharitis, these are the conditions seen in this. With euphrasia resembles a mercury in acridity, but its discharges are thick and excoriating, and that of the mercury is thin and acrid. So this is differentiation point with euphrasia to mercury. Staphyloma after suppurative inflammation can be treated with the euphrasia. After the euphrasia, one of the most important remedy is the Gelsin. In that lids are drooped, so there is a drooping of the eyelids. So it is useful remedy for the ptosis. Then eyes are half closed, apparent inability to move the lid. The lid closed on looking steadily at anything, and there is a lateral nystagmus on using the eyes with the mydriasis and pupils are sluggish. Subjectively, the eyes feel too large, protrude, as though bursting out of the head. There is a pressing, protruding pain. With the visions is the photophobia, spark, flashes, and a black spot on stooping with the object dance with the every pulse. Characteristic a tendency to sudden and violent irregularities of the circulation and rush of the blood to the head with the painless throbbing in the whole body or brain. And clinically, there is a sunstroke for heat, prostration, eyes are troubles from exposure to the very bright light and supraorbital neuralgia. So this is very useful in ptosis along with the supraorbital neuralgia. So next remedy is the graphitis. Objectively, it is a very inflamed lid margin, dry mucus in the lashes, canthal crack and bleed easily. There is an external canthus is inflamed, Morning agglutination. Think excoriating mucopurulent discharge with the lacrimation and redness of the bite. And subjectively, the patient feels that there is a photophobia, intense in daylight rather than in artificial light, with the light dazzles in the eyes and sense of a dryness in the lid and pressure. There is a heaviness of the lids and heat about the lid. So, heat is a burning, biting, and smarting in the eyes. With the vision of that there is a vanishing of the sight during the menstruation with the flickering pain. Pain writing later run together and appear double. So clinically, a few remedies are so frequently called for in the chronic marginal blepharitis, in the chronic inflammation of the lid, when there is a conjunctiva or cornea is inflamed, in the scrophulous subject, particularly when there is an intertrigo or eczema characterized by a moist crack which bleed easily. So there is a graphitis. In that cases, cracks and fissure is important which bleed easily. This is an important clinical feature along with the marginal blepharitis and chronic inflammation of the lid. So next is a hyparsal. Hyparsal, the patient shows that there is a upper lid are red, swollen, inflamed with the pressive pain and morning agglutination with the inflamed eyes, white red, profuse lacrimation, spasmodically closed lid in the morning. This subjectively the patient shows that there is an intense photophobia, eyes are very painful or ache in a bright daylight. If he attempts to move them, the eyeball is very sensitive to touch and pain sore as if bitten, pressing, throbbing, shooting, smarting pain in the external canthus with the hardened mucus and pressure in the eyes as from the sac. So vision shows that there is a obscuration while reading and dim sight by the candlelight. So there is a blindness on rising and standing after sitting bent over. Field of the vision reduced on half. Continual movement of bright circle before the eyes and object look too large. So oversensitiveness of the nervous system, hence extreme sensitiveness to touch in the cold air and the cold application, the sensitiveness makes the subject irritable. Which hasty the speech and action, this is a characteristic feature of the hyparsal. Clinically, the useful in a blepharitis, keratitis, panleticular inflammation of the cornea, corneal opacity, one of the most frequently used in eye remedies, acute phlegmonous inflammation, pustular ulcerative keratitis. हॅलो, हां बोला ना. माझं लेक्चर चालू आहे ऑनलाईन. 11 वाजता येतात. ठीक आहे. हो हो, बरी आहे का तब्येत?